The purpose of this short video is to introduce the novice to the skill of cannulation, or reintroduce an overview to an expert at cannulation. Cannulas come in a variety of sizes. We have the very small, for example this 24 gauge yellow cannula, which is used for applications such as chemotherapy in neonates, and much larger 14 gauge cannulas that are used in trauma and theatre type environments. This particular cannula, you can administer 1 litre of fluid in 2 minutes. The standard everyday cannulas that we use within this organisation, this pink 20 gauge cannula is very much an everyday use cannula, fluids, antibiotics. And for patients with smaller, more fragile veins, we can use this 22 gauge blue cannula. For those patients where the orange cannula is difficult to insert, we have an alternative. The next size down from an orange cannula is a grey 16 gauge cannula. And then the next size down once again is this 18 gauge green cannula. For a summary of cannulation size, everyday use, we tend to use the pink 20 gauge cannula, and for those patients who need rapid transfusions and infusions, we would try and insert the larger cannulas such as the orange and the grey, and for those patients whose veins could not accommodate that size of cannula, we would insert the green cannula. The general rule for cannulation is that we start to attempt to insert the cannula low down the arm and then work our way up towards the antecubital fossa. However, if it's a patient who's suffered a cardiac arrest or is a trauma victim, we attempt to insert the cannula in a larger vein higher up the arm where the antecubital fossa area may be suitable. Certain patients have restrictions to where you can place the cannula. This includes patients who've had a mastectomy or patients who've got renal fistula. In both of those circumstances, you would want to avoid the arm affected. Clean your clinical tray, prepare your equipment, and protect the key parts with the sterile packaging to prevent touch contamination. Palpate the vessel to ensure that it's a vein and a healthy vein. Clean the skin for 30 seconds in multiple directions. As you allow the solution to dry, pop on your gloves. Hold the cannula in a way that you are not going to contaminate the hub or the catheter material. Take off the protective sheath. Apply skin tension in multiple directions. Sharp scratch. Look for flashback underneath your thumb, which you can see. Lower the angle down. Advance just 1 millimeter in. Then fix the cannula in place with your finger. Withdraw the needle by a couple of millimeters and you will see a second flashback along the edge of the catheter material, as so, and then you can advance the cannula. At this stage you can remove your tourniquet. And we tend to apply strips to secure the wings. At this stage we get a short extension with a pre-filled saline syringe attached. The tubing has been primed. We occlude the vessel just beyond the tip of the cannula. We withdraw the needle. A safety mechanism will activate. Immediately dispose of the sharp in the sharps container. Attach the short extension. And at this stage you can check for a little bit of blood return, which there is, and you can flush. You need to flush with between 5 and 10 mils. Once you've finished flushing, you need to clamp before you disconnect the syringe. That prevents blood aspirating back into the cannula and occluding your cannula. Once you've assured yourself that the cannula is in place, we can apply the final dressing, ensuring that it is well applied. And then the final application is a date strip with the date that you inserted the cannula that goes on the edge of the dressing without occluding the view through the dressing, so that you can monitor the site for any redness. Peripheral cannula insertion is documented on our peripheral cannula care bundle. It includes the date, the time, the size, the lot number, number of attempts, reason for insertion, and your name. And then we indicate on the body where the cannula was inserted. Thank you for your interest in this short video. If you require any further information, please contact the Vascular Access team.